Regarding treatment of schizophrenia, antipsychotic medications can certainly reduce the intensity of symptoms, but the dosage levels need to be carefully monitored. They can produce side effects. They're better at reducing the severity of positive symptoms than they are removing or even providing relief for negative symptoms. And we had older or first generation antipsychotics, which are also called conventional or atypical antipsychotics, and they were viewed as effective treatment for schizophrenia, but they've been largely replaced by the newer atypical antipsychotics. So drugs like Thorazine, Haldol, and Prolixin, which worked by blocking dopamine receptors, led to the dopamine hypothesis of schizophrenia, but there was a high rate of discontinuation due to the intolerable side effects and failure to control the symptoms. They didn't always work, and they had some pretty terrible symptoms. Some of the symptoms are the extrapyramidal side effects like Parkinsonism, muscle tremors, shakiness, dystonia, slow involuntary movement, akathesis, motor restlessness, and neuroleptic malignant syndrome, which is muscle rigidity and autonomic instability that can be fatal if untreated. Similarly, metabolic syndrome, a medical condition associated with obesity, diabetes, high cholesterol, and hypertension, is associated with use of antipsychotic medication. And the newer antipsychotics cost 10 times more than the older antipsychotics. And in one study by Lieberman, 2005, from your text, actually performed less well and produced more side effects. And then, of course, we have a relatively large group of individuals with schizophrenia who don't benefit at all from any medication. And surprisingly, the top selling class of medications in the United States is actually the atypical antipsychotic medications, things like Seroquel, Abilify, Zyprexa, and Risperidol. Off-label use, using them for something other than their prescribed purpose of these atypical antipsychotic disorders for everything from attention deficit disorder, conduct disorder, anxiety disorder, has really increased, although the drugs have never been evaluated for these purposes.